My name is Rich Powell, and I'm the CEO of ClearPath. We advance policies to accelerate breakthrough innovations that reduce emissions in the energy and industrial sectors. First, I'd like to acknowledge the tragic loss to the committee of Congresswoman Walorski and her staff and express our condolences to her family, her staff, her team, and her district. Now, given this committee's vital role in America's healthcare infrastructure and response to the global climate challenge, I'll discuss three key topics today. First, how we can make our electric grid more reliable so America's healthcare infrastructure never loses power. Second, the policies we need to support the grid and reduce climate impacts. And third, how we can make our communities and healthcare infrastructure more resilient to extreme weather. Look, we all agree the climate is changing and global industrial activity is contributing. Now let's talk about solutions. Far too often, energy and climate policy is oversimplified to false choices. Renewables versus fossil fuels, economy versus environment, global emissions reductions versus inaction here at home. These false choices ultimately cloud potential solutions. Most studies suggest climate change has intensified, but you don't need a study to see that Houston experienced 3 500-year floods in 3 years, that Coney Island Hospital lost electricity during Superstorm Sandy in 2012 and had to close for 3 months, and that Roper Hospital on the Charleston Peninsula is planning an upgraded inland facility to better withstand floods. In response, hospitals have adopted advanced backup power systems to improve resilience beyond conventional diesel generators. Since 2000, combined heat and power systems have been deployed at 176 hospitals nationwide, just for example. Our electric grid is aging, and we are more reliant on it than ever. Calls to electrify everything from home appliances to hospital facilities means America needs more power, and it must be reliable and resilient. Many projections call for at least doubling the size of the grid over the next 30 years. Our hospitals need 24/7 power to serve patients. Just last week, a hospital in Santa Clara lost its backup power during the extreme heat wave. Thankfully, patients were transferred to other buildings. But now imagine if that hospital had tried to rely on a grid powered by 100% variable energy, calling on energy consumers to power down when the sun isn't shining and the wind isn't blowing. The false choice between a vision of 100% variable energy or climate catastrophe ignores the challenges of running a stable grid and the value of uninterrupted power, particularly in a crisis. Home health care is equally important. Access to cooling, heating, and around-the-clock medical devices can be a matter of life and death. In Texas, 25 people tragically died because their life-sustaining home health equipment lost power amid the statewide blackouts caused by Winter Storm Uri. American communities need more baseload, 24/7 generation with zero emissions, like nuclear, fossil energy with carbon capture, or geothermal energy, along with energy storage options. Today, summer heat waves in California demonstrate the importance of grid reliability. Record high temperatures increase electricity demand and cause power plants to trip offline. Californians are being asked to reduce their electricity use during peak hours. Policymakers there took significant, though I'd argue long overdue, steps earlier this month to keep the Diablo Canyon nuclear plant online to provide some much-needed baseload energy. Meanwhile, the grid itself requires significant modernization. The Bipartisan Energy Act of 2020 began supporting grid hardening and reliability improvements that are long overdue. Improved wires alone, though, will not matter if the power plants aren't available when we need them. While our American power sector is becoming cleaner, we still have a long way to go. Some of your colleagues put together the House Republican Energy, Climate, and Conservation Task Force and have been rolling out a suite of solutions that will help scale up clean energy technologies to provide more American energy while also reducing global emissions. The task force recommendations directly address our grid's reliability challenges. These include leveraging American innovation, modernizing permitting on new energy projects, unlocking the development of American resources, and investing in resilience. Communities with the right preparation and mindset can avoid some of the worst public health risks associated with flooding or other natural disasters, but it's also the fiscally responsible approach. When it comes to natural disasters, an ounce of prevention is worth a pound of cure. The American Flood Coalition, made up of local, state, and federal government officials working together on flooding solutions, has several clear recommendations for improving resilience to flooding. These include supporting community adaptation through federal funding and incentives, and providing innovation grants for research into flood mitigation technology. The task force has also developed policy solutions to ensure Americans are prepared to respond to and quickly recover from natural disasters. They have also proposed solutions to improve weather forecasting techniques to prepare earlier, further to Dr. Bittinger's recommendations. In closing, we should remember the story of America as one of innovation, and that's especially relevant as we improve America's healthcare infrastructure for the climate challenge. America and the world are going to need more energy, and our vision is that it can all be made clean and reliably. We look forward to working with you to develop and advance policies that accelerate breakthrough innovations to reduce emissions in the energy and industrial sectors. Thank you again for the opportunity to testify.
Thank you, Mr. Powell. And without